Good evening. Welcome to the May webinar presented by the National Keratoconus Foundation, which is a program of the University of California, Irvine. My name is Jason Marsack, and I will serve as your moderator this evening. Also with us tonight, Taylor Young from the National Keratoconus Foundation will be curating questions from the audience. So during tonight's program, if you have a question based on what you hear, you can type it into the question or chat box in your webcam application or your webinar application. We'll have some time throughout the presentation and at the end for a few questions. Tonight's topic is focused on the patient experience in the clinic and how patients and doctors can interact with one another. And it will be presented by Dr. Christine Sindt. Dr. Sindt graduated from the Ohio State University College of Optometry in 1994 and completed an ocular disease residency at the Cleveland Veterans Administration Medical Center. Dr. Sindt joined the faculty of the University of Iowa Department of Ophthalmology and Visual Sciences in 1995, where she is currently the director of the Contact Lens Service and professor of clinical ophthalmology. Dr. Sindt holds 7 U.S. patents and has over 150 publications. She's considered one of the country's top clinicians and researchers in the field of keratoconus. Dr. Sindt actively engages in ocular health research and is the founder and president of iPrint Prosthetics, a company that specializes in designing custom contacts for irregular corneas. Dr. Sindt is a fellow of the American Academy of Optometry, the Scleral Lens Education Society, and serves as an advisor to the National Keratoconus Foundation, where she was named a top doc in 2019. In my opinion, a title that truly describes Dr. Sindt is that of passionate advocate for her patients. I've really not met anyone in my time working in the field of keratoconus that has more energy and drive towards improving the lives of not only her own patients, but all patients who deal with this challenging condition. So I believe that this will come out during today's very unique presentation. You'll see we both have webcams on today. This will be a very interactive presentation. So without further ado, it's my pleasure to introduce Dr. Sindt.
Well, thank you so much for having me. When I was asked to do this talk, I was thinking what could be new, maybe something that we haven't experienced before. And I thought, I think communication is something that always merits a little bit more conversation, right? A little more communication. And so, I really stemmed this out of, we spend a lot of time at the hospital that I work at, with the talking to our doctors and our residents about how to talk to patients, about how to model that. We spend a lot of time talking about communication with the patient, but nobody ever really spends that time saying, well, you're the patient. How do you communicate with your doctor? What do they need to know to make you more effective in your treatment goals, to have better outcomes, and to be more satisfied with your care? Because probably the one thing that I hear a lot is, I don't think my doctor understood me, or I don't think I was getting the best care that I got. And my doctor's great, don't get me wrong. These are the things that I hear a lot of. And so, partnering with your doctor is something that we're going to spend some time talking about today. All right, so by way of disclosure, and I'm not going to be talking about any of this in tonight's practice or tonight's lecture, but I am the owner and inventor of iPrint Pro. But if you want to look up something fun at some point in the future, you might want to go to Mojo Vision, Google Mojo Vision, and see what's the next generation. Where are people going? What are we going to be talking about in 5 years or 10 years down the road when it comes to contact lenses and what our vision capabilities are going to be? A lot of fun researchers, amazing people that I'm working with to bring you more technology in the future. Okay, so historically, the patient-doctor relationship, the patient-doctor communication, think of those Norman Rockwell paintings, where there's very patriarchal. I am the doctor, you are the patient. I am big, you are small. I know things, you know nothing. And this causes problems. It causes miscommunication. It leads to feelings of being unheard. It leads to non-compliance, and it leads to looking around for other doctors. When a doctor has that sort of that attitude of do as I say, we're not looking, as doctors, we're not looking for what the barriers might be. Maybe you don't have a car and can't come back for your visits. Maybe it's financial. Maybe you don't speak the same language. Maybe there's something going on in your family that prevents you from doing what it is that I need you to do in order to get healthy. And so we have to have this communication back and forth. I really, as a physician, I really need to understand who you are so that we can create a situation where you can feel compliant and I can feel that you are following the treatment plan and we know what the outcome is going to be for that. And that's where it comes down. This historical, I am big, you are small, no longer works. If you feel that in your relationship with your doctor, then we need to work towards the new paradigm of doctor-patient communication. And that really evolves around this idea of a partnered relationship. I am not there to be patriarchal over you. I am there to partner with you. And this creates this good interpersonal relationships. It allows us to feel that we can exchange that information and that together we are making the decisions that you move forward with within your healthcare. And I have to tell you, as a physician, this is a huge relief to me. You know, when I don't have to make all those decisions for you, I can say, what is it that you want? What is it that is going to bring fulfillment to your life and help you can help me make those decisions for you? That is a huge lift for me. It's a big burden lifting thing in my treatment plan. So don't think of sharing information is making the doctor more difficult. It is a big relief. So feel free to share what you need to share. So there have been lots of studies out that have looked at this patient-doctor relationship, and one study or many of the studies showed that physicians, doctors who are informative, give you information, show you support in your life and what's going on, show you respect, and facilitate you participating in your care, actually have patients that are more satisfied, more committed to their treatment regimens, and it also experience better health outcomes. Now, I know what you're saying right now. Sign me up for one of those doctors, right? Man, find that doctor. I want that doctor. I'm going to travel the world to get that doctor, right? But here's the deal. It's not just about the doctor. It's about you, right? You actually facilitate those relationships as well. It's kind of like the saying, be the change that you want to see in the world, or quid pro quo, right? You want to be that person. You want those relationships. It's also part of what you need to do is to build that relationship with the doctor. So we also know that quality of care is actually affected by how the physician, how that doctor perceives you. Right? If the doctor sees you as more open, more willing to share, participating in your care, if they see that you are equally established with the outcome, and they are actually going to give you more information, more empathy, and have a more positive effect in your care. So the physicians will actually respect you more, and the physicians actually view you as a more favorable patient if you are actively participating in your care. I will tell you, as a doctor, it is very difficult for me if I have a patient sitting in the chair and I'm wanting to share with them and they just sit there and they just look at me and they don't actively participate in their care. It makes me go, well, I guess you don't care that much. So I've got a million things to do, and maybe I'll just go next door to the patient who really wants to tell me their story. And so I would encourage you, you will get better care if you have a positive attitude and actively participate. Okay? So patients are typically more informative, or physicians, are typically more informative and accommodating and supportive when you ask questions, when you make requests, when you actually ask the doctor for something. The doctors really, really want to to fulfill those requests for you, and they will look for ways to do that. When you offer opinions, oh gosh, I tried this or I tried that, and here are my concerns, right? Or expressing your fears and concerns. Doctor, am I going to go blind? I don't know if I could handle that lens. Those are things that we then know what the barriers are going to be, and we can solve those barriers. The other thing is, we really appreciate it when you follow conversational norms, right? So that would be things like talking, participating in a conversation that goes back and forth, not talking over the doctor, not talking over other people that are in the room. If the person that's with you wants to participate in the conversation, that's absolutely fantastic. But when the person that's with you is on their phone or you're on your phone, it makes it more difficult for the doctor to feel like you're participating in that care. Because when we understand what you want, we are going to meet your needs and we're going to meet your concerns. So this is this dynamic of reciprocity, this quid pro quo, right? The more you give, the more you get. This is true for really, gosh, any relationship, right? So whether it's a coworker or a spouse, you put good into the world and good will come back to you. I think it's a little bit like karma, right? You put good things out there, good things will happen to you. So again, this idea of reciprocity: patients who ask questions, patients who express concern, patients who state preferences will then have a physician who is informative, offer support, and accommodate requests. And the really great thing about that is then that makes both parties feel engaged in the process that is happening. When people are engaged, people are actually happier. And one of the studies that came out is that doctors who engage their patients and patients who engage their doctors are happier people and are more positive. So my job satisfaction, because my life's all about me, right? So my job satisfaction hinges on my relationship with my patients. This is my happy place. I do a lot of research. I do a lot of clinical trials, right? I see a lot of patients over the years. And, while I enjoy research, it's a lot of fun. My relationships with my patients are absolutely golden. I look forward to coming in every year and seeing my patients and catching up and knowing what's going on in their lives, sharing their joys, sharing their difficulties, right? Sharing their lives. And I share my life with my patients as well. And that process leads to happier communication. So I think we'll stop here for a second and maybe take some questions.
Yeah, sure. A couple of things. This is all really interesting. One of the things you were talking about kind of at the beginning is kind of the power dynamic, kind of the way things maybe historically were, and now the way you're certainly encouraging more of a partnership than a one-way. I think your words were, I am big and you are small. So do you have any advice for people to kind of maybe get over that initial hump of like starting the conversation or kind of initiating this kind of new dynamic that you're talking about? Because I can think, sometimes it may be a little bit intimidating to be in the exam chair, and then the clinician doctor comes in, they're working with you, and then they may be out the door. So do you have any advice on maybe evolving that, or maybe kind of bumping that up a little bit?
Yes, I think that it is, most doctors are aware that when you're in the chair, it's kind of a scary place to be, right? And that, you're waiting for answers, or you want to know what's going on. And that's a lot of stress, and it's anxiety causing. And frequently in those positions, the physician's a lot more comfortable. When it comes to keratoconus, wow, I can't even count how many keratoconic patients I've seen. But for you, it's you, right? You're the first. You don't know anybody else, maybe, and that's very, very, very scary. And it's okay to show those fears to your doctor. It's okay to say, hey, I am uncomfortable. I'm scared. I have questions, and I might not even know the questions. I don't even know what I don't know right now. I need something, right? It's okay to say that to your doctor, because frequently what you'll find when you show your vulnerability to the doctor is, you know, that doctor's writing, that doctor's typing, that doctor will put down their paper, will turn their chair to you, and will engage in your vulnerability. Right? It's human nature. We engage people that we see as vulnerable, and it's okay to do that. When you show that, then you level the playing field, because people will see you empathically. They will see your emotions, and then they will be able to talk to you about that. They will understand your fears. And so I would say vulnerability is a big thing. The other thing is open and relaxed postures. You know, sometimes I find that patients come in and they want to really sort of jump down into what is happening. And again, what's more important, and I'm going to get into this in a bit, is to knowing who you are, right? So engage the doctor in who they are. You know, ask them who they are. You know, how are you today? Do you have kids? Do you know, it's okay to ask questions like that.
Sure. As a reminder, if you have any questions in the audience that you would have for Dr. Sindt, feel free to put them in the chat and we will moderate some of those here. I have a question kind of related to this kind of satisfaction, both for maybe the patient and the doctor. And if this is something we're coming to downstream, we can wait. And maybe it just has to do a little bit with expectations. And how how a patient's expectation and the doctor's expectation can influence the relationship. You know, sometimes when we're dealing, well, not me, I'm not a clinician, but when maybe you're dealing, or clinicians are dealing with individuals with keratoconus that have complicated optical challenges, maybe the outcome sometimes is not as ideal as maybe the patient would want or the doctor would want. And do you find that has an impact on the relationship, or is that something you're able to manage?
You know, I think that the more seasoned I become, and I think that's a euphemism for gray hair, but the more experienced I become, it is much easier to manage expectations. It's going to be much easier for some physicians to manage expectations than other physicians, to be honest. When I engage a patient, I personally am able to hear what a patient says, but hear what the patient's really saying, right? And that's a skill set that's not always, not everybody has that skill set. So for example, you know, a patient may be saying to me that they want contact lenses to wear to this event or to that event, but what I'm hearing is what I'm feeling from them is that maybe they want to wear them all the time. They're just too afraid to say that, or vice versa. And so I will circle back around with the patient and say, I'm hearing this. Is this what you're saying? But it's okay as the patient to circle back around and ask these questions too, what they're hearing out of the conversation. Setting expectations, and we're going to get to this, but setting expectations is the single most important thing that in your doctor-patient relationship. To be honest, for me now at this point in my life, I can pretty much fit a contact lens on anybody. But what you want to do with that contact lens, that's a different story. What you want to do with your life is a different story. One of the things I'm fond of saying is that if I just had eyeballs sitting in my chair, my job would be very, very easy. But it turns out there's people wrapped around those eyeballs. But the complicated part is there's lives wrapped around those people, and managing the lives is the difficult thing. So really, in order to manage expectations, I have to know who you are, right? And you have to be willing to share who you are with your doctor. You know, and there will be no judgment. I have no judgment with what people tell me. But if it's important to you, it's important to me.
maybe another aspect of the dynamic that's very different for the doctor versus and the patient is that, you know, the doctor may be seeing, say, 10, 15, 30 people in a day that have, say, for instance, keratoconus. But in the case of the individual patient, they may not know anybody else with the condition. So I can imagine that sometimes when patients come to the clinic, it really is an opportunity for them to talk about a lot of things that may be of concern to them that they may just simply have no other avenue to talk about, if that makes sense.
Yeah, excuse the small person in my background here. You know, early on in my career, and I don't have the ability to do this anymore, but early on in my career, I used to schedule my patients so that patients with similar conditions were coming in at the same time. For example, all my babies were scheduled together so that other mothers would see other mothers and be able to talk, or people with keratoconus would be able to talk to other people with keratoconus. I've lost that ability with current medical record scheduling systems, but talking to other people is a very important part of understanding the disease. I do caution people that, you know, the internet is a very scary place, and there are people on there that can be predatory. So don't just take advice that you hear on the internet, but really check in. I actually have a slide coming up on that as well. But, you know, as far as the patient-doctor relationship, I like to hear people's stories. You know, this is important. You know, the good and the bad. You know, I don't just want to hear about how your eyes get red. You know, I also want to hear about going to the school play. I want to hear about, you know, a teenager passing his driver's test. These are the little achievements in life that actually make my job worthwhile. But I'm also willing to sit in your discomfort. I'm willing to sit when it is difficult for you. You know, that's really what empathy is all about, is when you can sit in somebody else's discomfort and not try to fix them, but just to hear them out and then ask them how they want to be fixed. That is the key to communication from the doctor's side with the patient-doctor relationship.
Yeah, that's great. Let's see, am I muted? No, okay, good. Okay, we do have a couple questions coming in. You know, during the exam, you're collecting a lot of information. Do you have any kind of tips for patients talking to their doctors about wanting to know more about the information you're collecting? For instance, you know, you measure corneal topography, you're looking at that, the patient may see the screen also and is interested in that. Like how would a patient simply, would you be receptive to them saying, hey, will you explain that to me? Or what's a good way to initiate that kind of conversation?
Yeah, I think that's a fantastic. Can you explain that to me? That's a great way to say it. You know, that's one of the things that I always try to incorporate into my examination. Certainly into the first examination is as I pull it up on the monitor and I talk the patient through it. What am I looking at? What am I seeing? To be honest, I don't give all of the information of what I'm seeing. I give the pertinent things, the things that most people can visually see and understand. What I typically do is say, this is what I'm seeing, and this is what it means to you. This is how this information is going to affect you. This is what I need to monitor over time. These are the results that I am going to continue to look at. And I also cut and paste all of those results and interpretations into my chart notes as well. There, you know, recently was the medical act where everybody should have access immediately to their patient record. You know, and it's perfectly okay to review your patient record and then call the doctor back and say, I don't understand this, or I don't understand that, or can we set up a time to do it? Now, I want you to keep in mind that we are not going to send you to medical school, right? We're not going to give you a mini medical course. So there are limitations as to how much you can understand without going to medical school. But it's really important to understand what those test results are saying, right? Because I want to show you what's happening, but I also want you to understand how that affects you, and how it affects you is really the most important thing. An example of this would be, sometimes I have patients look at me and they go, how do bifocal contact lenses work? And I have a little spiel that I give, and they're like, but no, how does it actually work? And I'm like, ooh, now we're getting into some optics that are pretty complicated. And I start to tiptoe in and gauge out the patient of whether they're going to be able to really understand that information. So, there's limits as to what we can do, but I would always encourage you to ask the questions. Ask the questions. Anything that pops into your head, it's okay to ask the questions. And you know what? It's okay for me to say, wow, that's pretty complicated. Maybe we can circle back around on that on another day.
Yeah. Okay. Maybe the last one in this little segment, and we can maybe move forward here. I mean, like all relationships, we kind of need to set personal boundaries. Do you have any kind of methods you use or advice for individuals in terms of establishing those for the doctor-patient relationship?
Yeah, it's really easy. Again, I am big, you are small. In the past, there seemed to be a lot of boundaries that were set on the doctor's side, things that you should or should not ask your doctor. And I think those boundaries are a little different now, and they're a little blurrier now, right? And like you said, any good relationship is going to have boundaries on it. For example, typically I would not want to be called at 10 o'clock at night, because you had a question about your topography. That would be, I would probably say, hey, that's a better email than a phone call, right? But if you are like, my eye is red and on fire and falling out of my head, I want you to call me at 10 o'clock at night, right? So there's different boundaries for different things, and it's okay for the doctor to help establish those boundaries. But here's where the paradigm shift is. It's actually okay for the patient to establish boundaries as well. And let me give you an example. I am on a university campus, and so I have people that are from many different countries, many different religions, and I don't fully understand them all. I will tell you right up front, I don't understand them all. There are cultures that I am not part of, so I don't know the subtleties, right? And so pre-COVID, I would stick my hand out to shake people's hands, and some people are uncomfortable. I am stepping over somebody's boundary if they just go ahead and shake my hand, right? It's okay to say that makes me uncomfortable, right? Some of my patients want to be hugged, right? And they can say, can I give you a hug, right? And then I can say, I would like that, or no, I'm not comfortable with that, right? So there are boundaries that way, but there's also boundaries with what you want to be called. I want to be Mrs. Jones, call me Sue. There's different boundaries that are personal boundaries. There's boundaries with your medical care. I have this other part of my medical care going on, and we can discuss it if it affects my eyes, but otherwise I don't want to talk about it, right? Or there's this other part of my medical care that's going on, and I do want to talk about it. I want to talk about my mental health issues with you because I think they're affecting my vision. So it's important to tell the doctor what your boundaries are. Believe it or not, a lot of us have little, in my medical record system, it's called a Post-it, but most medical record systems do. And when people express boundaries to me, I actually write it in the medical record system. An example of that would be hand washing, right? I wash my hands or use hand disinfectant every single time I come into the room, but some patients, and especially during COVID, really need me to be very overt about that. And so I will say, I'm going to wash my hands now. And I will then overtly go and do it. It makes the patient more comfortable. It's no skin off my teeth. I don't care, right? So if you tell your doctor, I want to see you wash your hands when you walk in the room because that makes me more comfortable, that's a perfectly okay boundary to set with your doctor. That's totally okay, right? I put a little post-it every time I pull that patient's record up. It says, go wash your hands before you sit down. Okay.
Wonderful. Great. Well, why don't we continue here a little bit, and we'll have some time for a couple more of these questions as we go forward.
All right. Okay, so let's moving on to telling your story, right? Everything hinges on your story. And this is where people tend to abbreviate, or they don't tell their story, or they don't tell their story with vulnerability, right? And it really affects that relationship. But I'll tell you what, when you're happy, I'm happy. And I want to land in that place where we are both in agreement of what success looks like. And unless I know your entire story, I am not going to be able to get there. And so again, your entire story, your truth, your honesty with vulnerability. All right, so what should you do? Do speak up and don't censor, okay? Start at the beginning. I want to know, how long have you lived with keratoconus? How does it affect your life? You can write these ideas down here, right? Because I'm going to ask you. Your doctor's going to want to know these. How long have you lived with keratoconus? How does it affect your life? What does that mean? How does it affect your life? Can you drive? Does it affect, do you not do things at night anymore? Okay. How has it changed your life? I am a different person now. I used to be happy and now I'm sad. I used to be outgoing and now I feel like I can't see, or I feel like my eyes always hurt, so I'm looking down. I'm not the same person I used to be. I miss that person. Those are very honest and vulnerable things. And maybe I can and maybe I cannot help you with those, but when I hear that, and then months later, I see that patient sitting in my chair and they're looking up at me and they're smiling and they're not in pain anymore, I know that I met one of their life goals. Are there things you avoid because of it? I avoid going out to people's houses. I avoid driving after dark. I avoid being on the computer. What have you tried before this? I want to know, have you tried contact lenses? What have you tried? What was your experience? When did you try it? Right? How long ago was that? I have patients that say to me, gosh, I tried contact lenses 15 years ago and it did not go well. And my doctor insisted to refer me to you, but I just don't see where this is going, right? That is a barrier to communication. I want to know, what did you try and what was your experience? And I might say to you at this point, well, you haven't tried them with me. We have some new things, so we're going to talk about that, right? I want to know, do you have handling problems, handling issues? Have you had surgeries? Have you had other procedures? Have you had cross-linking? Are you a post-LASIK person? Right? What's your timeline for all of this? And why do I want to know all of that, right? Because that's going to affect what I actually see coming out of you. I'll get that to a slide in a second. The other thing is, don't minimize your concerns, right? Oh, it's just blurry, I can function okay, right? Because when I hear it's, well, I'm a little blurry, but I'm okay, right? You might think that your doctor's going, shoo, don't have to do that, right? But what does that mean to you? It's just blurry, I can function okay. That's kind of like, don't worry about me, I'll just sit here in the dark, right? Or no, I'll just sit here in the corner, don't worry about my life, right? If you're really afraid, like, I'm going to go blind, I'm afraid I'm going to go blind, I think about going blind every single day, right? I've had patients say to me, if I go blind, I'm going to kill myself, right? These are very, very real and deep-seated issues that are going on in people's head. And you know what? Sometimes I look at people and I'm like, so first of all, you are never going to go blind. Ever. Not from this, not from keratoconus, not from where your disease is at right now. We're going to manage it. We're going to have a timeline. We're going to take care of it. And it's going to be inconvenient. I'm not saying it's not, but we're going to move on with your life, right? But this person, in my mind, had been carrying around this, oh gosh, it's just this thing on their chest and this fear forever. Don't minimize it. tell the doctor exactly what you're thinking, your deepest fear, right? Because once you manage what you're really concerned about, the rest of it is easy. Okay. So what am I listening for? I'm listening for your level of acceptance with the disease. Is this new? Are you still trying to figure it out? Or have you lived with it for 15 years and, you know, it's just part of who you are now, right? What is your level of acceptance? I'm listening for your emotional state. Do you have anxiety about this? Or are you okay with this? Where are you in your cycle of grief? What will bring quality to your life? You know, some patients say, you know, I don't drive anymore because of it. But after talking to them, I realized that's okay. That's okay, right? But other patients, I know, man, if I can get them driving again, this will be absolutely huge. This will be a big deal for them. Okay? So I want to know what brings quality to your life. I want to see my kids. I want to see my daughter perform on the stage. You know, spending time doing this activity or that activity or sewing, those are all very important to me. And that leads into your expectations and your goals, right? I am listening for what you are not saying. I am listening for the message under the message. Your doctor is thinking what you're saying, but what are you not saying? I want to know what you think you already know, right? I have a lot of patients that spend a lot of time on the internet, and I want to know what they know, because either it's right or sometimes it's super wrong for them, right? It's super wrong for their lifestyle, right? I have patients that come in and they've researched corneal transplants, and they don't need a corneal transplant, and they will never need a corneal transplant, right? So I want to know what you already think you know. Basically, what it comes down to is your doctor wants to know you, right? Because it's not eyeballs in the chair. We are treating you as a person. I could have 4 rooms, 4 same eyeballs, and I will do different things in every room because you are the ultimate reason that we are working. And if you don't share you, we don't know you, and you won't get the outcome that you want.
Dr. Sindt, quick on that point, maybe if you don't mind, because you had mentioned on that slide about minimize, like there may be a tendency to minimize, and that you were recommending that's not necessarily helpful. I do think, but maybe you have some thoughts on this. I think maybe one reason why an individual may kind of rationalize that they would minimize is because perhaps the doctor's office can be a scary place, because you know it's a place that you could learn additional bad news.
Right.
So I do think that some of these visits for some individuals could be almost, maybe scary is too strong, but there could be a level of concern about, you know, what will I find out today, or is this because that's one of the real challenges I think with keratoconus is it does progress, and that sows uncertainty.
Right. There can be absolutely, there can be a level of, if I don't know the answer, I can hold out hope, right? And we can never, ever, ever mess around with somebody's hope. Hope is sometimes all people have, you know, hope that maybe someday, maybe one day, you know, and to be told that there's no hope is life altering, is probably too bland of a statement. You know, not having hope is really the end for many people. I had, you know, when I was first developing eye print, right? So taking impressions and developing these 3D lenses based on somebody's individual eye, I worked with somebody who had keratoconus, right? And he was in there doing my clinical trials. You know, I was figuring out things, and his mom, or this person's mom, said to me, I want you to see my son, my other son here. And I said, well, you know, he's very complicated, many surgeries, many issues, very, very, not keratoconus, but very, very complicated person. eye. And I said, oh gosh, I'm doing clinical trials and the FDA is like super strict, about who you can have in your clinicals. And she said, please see him. And so of course but one of my lack of boundaries is I tend not to say no when people need me. But I said, okay. And so he came in and I took his impression and I created this, maybe one of the craziest contact lenses I have ever seen. Actually, his lens is coming up here in subsequent slides. And then I called him and we said, your lens is here. And he didn't show up. 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 Anyways, months later, like 6 months later, his mom's back in doing the clinicals for me. And he said, did my son ever show up? And I said, no. And she calls him up. She's like, get over here, And he shows up. And he put on the contact lens. And he comes in, and his eye is covered, and he's got all the lights out, and he's got like a baseball hat on, and his eye is covered, he's just a miserable looking person. And he puts in the contact lens, and like he looks up, and he takes off his baseball cap, and it's this huge smile on his face. And I was all like, woo, 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 me, look what I did, yay. And then I realized what he said to me was, I didn't want to come back in. And I said, why? And he said, because if this didn't work, I gave up hope. And I was probably going to kill myself. And I realized that understanding my patients, man, I just wanted to do a cool lens, right? But understanding this concept behind patients that hope is everything, and I can't mess with that, is absolutely huge, right?
Yeah.
And so I'm really glad that it worked, but yeah, don't minimize your concerns, right? You got to tell your doctor that. Put some of the pressure on them. Let them share that burden with you, because they will take it very seriously, right? And you know what? We've got a network on the doctor's side, and we will phone a friend. We don't share this burden on our side either, right? We'll phone friends.
That's a good point. There is that kind of, one of the things that I wish that that individuals that are dealing with these challenges, sometimes they had a better window into was what a big network of people is really trying to move things forward. I know that from the patient perspective, because I myself am a patient, so I have kind of these two perspectives, but I think sometimes you feel that things are moving slowly, but on the other hand, there is a relatively large network of people who are committed to this particular group and working. That's what they do for a living, if you will, is try and develop kind of new technologies and to your point, to kind of continue to make hope in the forefront of people's minds. So,
and Jason, one of the things that I find, and perhaps you could elaborate on this, but those people out there that are really on the forefront of technology and making it better are incredibly approachable, right? These people are just the nicest, smartest, top-class people out there, and they genuinely, this eye care is really neat because they genuinely just want to make the world a better place.
Yeah, for sure. I think, anyone who, I think in general, people who are kind of developing or trying to build something want to talk about it. So that's certainly a true statement. And I think that one of the things I noticed is the community of people is just kind of across the board. It's like we want to float all boats because it kind of takes a big village here because everybody's problems are slightly different and things. So, but yeah, it's an incredibly rewarding field to be in, and the people that work in the field. And you almost wish that there could be more interaction between the two groups, because I think it would be really informative and fun for both groups. So.
Mm-hmm. Yeah, I like the idea of floating all boats. If I teach my patients, right, or if I teach other doctors, or I teach somebody else, or I learn, right, then we're all better off. We're better as a team. Yeah, for sure.
Agreed.
Okay. All right, well, we're gonna spend all night talking about this, so let's get going a little bit here. But things I want to know about the lenses you are wearing. So please, 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 please come with this information to your appointment. I want to know what they are. I want to know the specifications. I want to know what went into them, right? Because that's gonna really help me decide what we're doing next, right? I want to know how often you wear them. How long in the day do you wear them? You know, are you wearing them 16 hours or are you wearing them 2 hours, right? How old are they? How often do you replace them? Okay. What solutions do you use? Cleaners, storing, filling solutions. Have you ever had a problem with any of them? Have you had any allergies to any of them? And do you have a specific problem when you're wearing your lenses? Vision, comfort, fogging, redness are examples, right? Come with this information so that I can then assimilate that into what we're going to do next. I do not want to do the same thing to you that you just had done at a different practice. I want to offer you something different and to explain to you why it's different. Okay. I want to know if you have glasses. Please bring them with you. Okay. I know a lot of you cannot wear glasses. I get that. But I also know a lot of you say I can't wear glasses, but you have some thing at home that might have like a paper clip shoved into the hinge, you know, because it actually is helpful to watch TV at night or to get you from the bedroom to the bathroom and back, you know, all sorts of things. So I want to know what they are. Bring them with you, and I'm going to put that in the chart in case that paper clip actually breaks at some point. I can get you another pair of glasses, because even if you're not wearing them to work, they may be helpful. Here's the weird thing about keratoconus. What I refract you at is not necessarily what you enjoy wearing. So if you have a pair of glasses that you can tolerate, I want to know everything about those glasses, because I may not be able to duplicate that. You know, your cone, right? It's a cone. This is a different prescription than this, than this, than this. And where I refract you at and the power I get for you could be different from day to day. I really want to know what some old cruddy habitual glasses that you have in a drawer. It actually, at some point, I want to have that in my medical record. Okay. Lists are great. I love lists. You know what? Organize yourself before you come, right? Make a list of all the questions, everything you've read on the internet, everything you've had in the chat room. I love lists. I absolutely love lists. Doctors love lists, man, because we can tick those things off and make sure we get to them. But here's the deal. I am probably not going to go over your list until I hear your story, right? Because I don't know how to answer those questions until I know who you are, okay? But tell the doctor, I brought some things I'd like to go over with you at today's visit. Okay? The doctor knows that they're there, and then when you are ready, after you've told your story, the doctor will say, let's see that list. Let's go through it, okay? But I may need to examine you before I can answer the things on your list. Okay. The other thing is, you always need to remember, Dr. Google is okay. Google it, please. Google it. Dr. Google's out there, right? Find that information, because it will, that I can then address those concerns. This is good for you. This is not a good option for you. Stop looking at that, right? But the deal is, Dr. Google doesn't know you. So what's different between Dr. Google and me? I know you. I know you, and I want to know you, right? And I want to know what's going to be good for you. So Dr. Google's okay, but just use it to make the list. And how do I want to relate to a specific problem? Okay, remember this acronym, FORD. I want to know frequency, how often does it happen, onset, relief, and duration. FORD. Every time you tell me something, every time you call me with a complaint, I want to know those things, right? Have them ready. How often does it happen, right? When did the problem start? What have you tried? Okay. And how long does it last for? Each episode lasts for. An example, every time I take off my lenses, my eyes get red. It started about a month ago. I switched cleaners and I've tried to take them out when I get home from work, but they stay red until I go to bed. By the next morning, they're okay, right? That gives you all of that information: frequency, onset, relief, duration. Okay. Bring your previous records with you, but don't expect me to look at them during the exam. I'm not going to sit there and go through every page of your doctor's records. If there are specific things that you want me to look at, what does this mean? What does that mean? This is the things that we tried. Put little Post-it tabs in them, right? I will look at that information. I may dig through it to find out what your contact lenses were that you were wearing before, but I'm not going to sit there and read your entire note while you're in your exam, because in the exam, I'm more interested in finding out who you are. Okay. Black and white copies of topographies are useless, right? So you bring them, but I'm not going to look at them. They're not going to tell me any information. Okay. And make sure I have your current lens parameters. I've said that twice in this, kind of important. Okay. It was really difficult on me when you come in wearing lenses, we decide you're going to stay in them, and then I literally am spending 45 minutes trying to track down what they are. Okay. That takes a lot of time during the day that I'd rather be spending with you or other patients.
Before you move on, just a quick question. Should we bring our prior lens parameters to the appointment? That's a
yeah. I think in case I didn't mention it, yes, please bring your prior lens parameters to your appointment. All right. Are there any questions at this point, or should we just move forward?
Yeah, we do have one. One of I think the thing that kind of comes out when you talk about these things is you really have a desire to put yourself in the shoes of your patients, empathize and understand them. But perhaps there is a range of kind of personalities with all people, certainly doctors as well. So if maybe some of these things you're talking about, if patients are having difficulty relating to their doctors, maybe there's not like the communication of a long-term plan or something like this, what would you recommend? I mean, would you recommend?
I actually have a slide coming up that at the end where we're gonna actually talk about that. There's a large variety of people that are out there. Not everybody is as empathetic as I am. I get that. You know what? Not all patients want me to be empathetic, right? Some patients, just the bare facts, folks. You know what I mean? Some people just want, they want to come in, they want me to tell them what to do, they want to do it, they want to go home, and they don't not want a lot of chit chat and exams. And there are doctors out there that are like that as well. I know people who are very good physicians who hire staff that are very empathetic, right? And so but you have to have the relationship that you want, right? So that means that you have to ask for what is fulfilling for you. People are not going to just know what is fulfilling for you. If you need more from your doctor, ask them, right? If you need less from your doctor, we usually figure that out because you're not talking, we won't talk as much either. All right, so we brought up expectations before, but let's go into expectations a little bit more here, right? So do you have any fears like touching your eye, right? I sometimes send patients home with eye touching exercises just to get over it before I see them again, right? Because some people, eyes freak some people out. I mean, I love eyes. Some people, they do not want the eyes, and the idea of putting something in their eye is just totally heebie-jeebie to them, right? But what other things that I need to know are, if you're going to wear contact lenses, when do you want to wear them? Where do you want to wear them? How long do you want to wear them? And we need to set expectations about comfort as well. Balancing out comfort and time and vision. Sometimes all those things don't line up. I have to prioritize what is going to be the most important to you, right? So before we do anything, it's very important that you discuss these things with your doctor, like the exam fees. What are you going to be responsible for? Okay, and material fees, the contact lenses, any other out-of-pocket expenses that you may experience, right? Sometimes there's a disconnect between what the patient thinks everything's going to be covered by insurance and it's not. And that's terrible, but I want to have that conversation ahead of time. I don't want to fit somebody in a contact lens, find out their insurance doesn't cover it, and then have the patient stressing and having anxiety over the cost of things, right? Insurance submission. Am I submitting it? Are you submitting it? What are you responsible? If this doesn't work, what is the refund policy? But there's also hidden costs that you need to talk about too, like the number of visits, right? Because time out of work actually matters, right? So it's not just, oh, you know, this is going to cost me X amount of dollars. It really comes down to, I'm going to miss 3 days of work. 3 days of work is going to cost me X amount in productivity, right? Not only that, well, gosh, I'm not going to be able to drive myself till we get this done. So I'm going to bring Mary with me, and Mary's going to be out of work. There's lots of hidden costs that you need to think about ahead of time. You know, what are the hidden costs of remakes or shipping, and the hidden costs of cleaning supplies? I had a patient once who, many times actually, but one really stands out in my head, who I bent over backwards, and he had no insurance, he had no money, and I bent over backwards and I got the lab to donate a contact lens, and man, I thought I was all proud of myself, right? I thought I did the best thing in the entire world, getting this guy this free contact lens. The problem was that he had no money and he couldn't buy his cleaning supplies. And when I eventually saw him back for follow-up, his entire cornea had blood vessels growing over it because he never took it out because he had nothing to clean it with. And I actually damaged his eye. So this free contact lens that I was all proud about, I actually caused him damage by bending over backwards and going out of my way to get him a free contact lens. So, you know, you need to talk about that long-term plan. If you can't afford the products, you need to talk about, excuse me one second. Okay, honey, you need to play with your Legos? Okay. Oh, we will take care of you. I'll be right there, okay, sweetie? Sure, people. We apparently have a Lego incident going on in my house. But we need to make sure that we secure all of the hidden costs before you, so you won't be unsuccessful or worse yet, hurt yourself. And we need to talk about the cost of discomfort. You know, if you hurt all day long, you can't put a monetary price on that. But if you hurt all day long, that wears on you emotionally, it wears on you physically, it's going to decrease your productivity. So there's hidden costs that aren't just financial in these situations. Ask for resources and share your resources, right? So I have trusted partners out there, like the National Keratoconus Foundation. I will send people there. This is a trusted resource. This is where you can get information, right? There's other Facebook groups out there that are really well run. There are Facebook groups out there that are not so well run, right? And there are places where you can buy supplies that are very well run, and then there are places that may be uncomfortable. But you need to find out from your doctor what are the resources that they like to work with. When you find a really good resource, I would sincerely appreciate it if you would share that back with me, right? Because I will then share it with other people. You know, people say, I found these great goggles, these dry eye goggles. They're amazing. I love them, you know, and I write down that information. I can share that with other people as well. So sharing things back and forth, sharing resources back and forth is very, very important as well. And once we've gotten through all of these, I hear your story, then it's my turn to talk, right? Then it's my turn to address the things that I heard you say. And I will typically say things like, I'll tell you, what is the disease that you're dealing with? Where are the gaps in your understanding and information of what you understand? Why do you have it? What is it? Why do you have it? Genetics, environment, eye rubbing. What are your topographies? What is the interpretation of them? Maybe other testing that I've done along as well. Photographs, if I've taken photographs, I will show them to you and I will explain what it is that I'm seeing on your eye. You know, I take a lot of pictures on my phone. I will just take a picture of your eye and pull it up and we will talk about it right then and there. It's okay to ask for that, right? Hey, can you take a picture of my eye and explain to me what you're seeing, what's going on there? Do I have individual concerns for you? Like, oh boy, you know, we got to get those eyelids cleaned up. because you've got a lot of blepharitis or meibomian gland dysfunction. Let me tell you what that is and why we have to clean that up before I'm going to put a contact lens on you. Do you have anatomical concerns? That pinguicula, that bump, that lump on your eye, this one that I just took the picture and showed you, that thing right there, that is going, it's not doing anything right now, but oh man, that is going to cause us a lot of grief. How are we going to get around that? What does that mean to you? And then we'll talk about lens options, right? Stock designs, individual designs, things like that. I will typically tell a patient, today I'm going to give you a lot of information. Please feel free to ask me questions. I will give you a handout and we can go over this information again at any time. Going back to the idea of fear and the idea of concerns, it is perfectly reasonable to think you understand everything while you are hearing it come from the doctor's mouth, and then go home and realize you understand maybe 30% of what happened, right? Make that list, write down what you want to talk about again. We are more than happy to go over it and to talk to you about that particular thing again. What did you say about that bump on my eye? What is it called? You know, why are we concerned about it, right? I give you a lot of information. Your doctor gives you a lot of information, right? You don't have to remember it all. You have to remember that your doctor is there to answer your questions should you have them. And this discussion of lens options, this is again going down that path of meeting your goal and expectations. Gosh, it would be really nice if I could, you know, everybody could drive that fully stocked Cadillac off of the lot. But that's not really going to happen, right, with everybody. But you need to understand what you're going to get with each type of contact lens. You know, is a soft lens an option? What about gas perm lenses? You know, little ones, sclerals, you know, off-the-shelf type variety, diagnostic fit lenses. Maybe you've got that bump that's a little too big. Maybe your pupil is off center. Maybe you don't close your eye all the way. Maybe you have other problems that are associated with a lot of astigmatism of the eyeball itself, the globe. Maybe you want a multifocal, maybe you need prism, maybe you have a lot of higher order aberrations. And in order to meet your goals, we're going to have to go with a more custom type of contact lens, right? But you have to understand, you have to go back then and say, well, you know what, your iMed probably isn't going to cover a higher order aberration covered contact lens at this point, right? What do I want? What's my expectation? You know, if your expectation is everything's going to be covered under iMed, some people can get away with that and some people can't. You need to have that conversation. Am I going to get everything that I need? Right? And then together, and this is maybe the most important slide. This is the last slide, I believe. Maybe the most important slide that you're going to hear is you develop a care map. A care map is a roadmap to success. So what a care map is, really what you're saying is what is going to happen today, what is going to happen at the next visit, and where are we going to end up? Where do we say stop? What does success look like? So at that very first visit, you and we will know what success is going to feel like when we're done. Okay. So even after the very first visit, I hear your story, I share my story and what I have to share with you. Then the time is to sit back and say, what is what is going to happen today, right? And so then I will tell you, well, we're going to put a contact lens on your eye, or I'm going to go get another scan of your eye, right? Then I'm going to put a lens on, I'm going to figure out what your power is. Then we are going to design that lens, and then we're going to order that lens. You're going to get an email, you know, about the lens order. Whatever the process is for that office, they need to explain all of that to you. What is your care map for today? What should I expect in your next steps? What are your next steps going to be? Okay. Your care map is also going to include other medical care. Do you have cataracts that we need to address? Should we get you cross-linked before we do anything? Do you have dry eye that we need to take care of? Is your face melting down your face? Do we need to lift your eyelids back up? Do we need to put your cheeks back where they need to be? Because if your idea of success is maybe managing your dry eye, I may have to modify your eyelid placement in order to have that ultimate success. And then at your follow-up visits, I'm going to dispense the lens, but I'm not going to check the power till your follow-up visit because I want to make sure that the lens is settled in. Whatever it is, but you have to set those expectations of what's going to happen at each visit, and then you will feel handled, right? I will feel like we have no loose ends. You will feel handled. And when we as individuals want to be handled, right? We want to feel secure and that we know what to expect and what's going to happen next. Okay. And then all of this can go in an after visit summary. It's okay to ask your doctor for the after visit summary. The after visit summary is going to list all those resources. The after visit summary is going to have an explanation about your disease. The after visit summary is going to list out this care map. We're going to order this lens, but I'm going to have you have a consult with the oculoplastic surgeon or the cataract surgeon or the cornea surgeon. So lots of different things, but the care map is the absolute key to success. It's okay to ask for a care map. Write down your expectations. It's perfectly okay to ask for that. All right, and I'm going to open it up for final questions, if anybody has any.
Yeah, maybe two quick ones here. I really appreciated your point about how in the moment when you're together, doctor patient in the room, you may think you have this full comprehension of everything that's being said, and then go home and be like, wait, what was it? So right. As a practitioner, would you have any problem with a patient taking notes while you were talking to them, maybe so that they could?
No, note taking is absolutely fantastic. It's even better if you have a person with you to take notes so that you can be engaged with the doctor, right? I will frequently tell patients, you know what, I'm going to write this down for you. So I want you and I to talk right now. I will give you this information in the after visit summary, right? I will write this down. And sometimes I will actually have a sheet of paper that I will just write some notes down on it. So I remind myself to put things into the after visit summary as well. And so some people, some people are auditory learners, some people are visual learners, some people are tactile learners, right? And so knowing your own personal learning style is the best way to take in the information from your doctor, right? So you can ask for that information. You know what, doctor, I'm going to need to hear this again. Can you repeat that? Or can you just give me a handout on this? I want to go home and read about it. Right? Or doctor, I'm a tactile learner, so I'm going to write this down because when I write it, for me, that is knowing what is happening.
Sure. Well, it's really interesting. I keep as a scientist, I keep a notebook. I write everything down all day, every day, but I've never taken notes in the doctor's office. And I'm thinking, now that we're talking about this, I'm thinking, why didn't I do that? Because I go to the doctor because I have questions. So that's good. Right. I really like your advice about having someone else do it so that you can be engaged in the visit. That makes a lot of sense.
Yeah, and we know, like when we interview, what do? You lean in, when you lean into somebody and you're interested in them, they will lean into you and you'll have a more dynamic conversation. So the fewer barriers that you can have between people, the better. I personally prefer it when I call them my plus ones, when I have the patient and they're +1 in the clinic, because then I feel like they can go home and have a conversation on the ride home about, she said this, no, she didn't, she said that, I heard this, well, I heard that. And then they call me up later or send me a MyChart message and say, I heard this or I heard that. What are you talking about? And it gives me an opportunity to clarify. Or it gives me opportunity to say, like, you're spot on, or whoa, you're totally wrong. Let me call you up and we're going to have that conversation again.
Yeah. So maybe just last here, kind of thinking about the things you've said tonight, and feel free to kind of redirect this a little bit. But I really appreciated this. What I'm hearing is that it's patients, individuals who are seeking help from medical professionals should feel empowered to advocate for themselves, and that maybe we need a paradigm shift to start thinking about these interactions as kind of a teamwork, rather than maybe, like you were saying at the beginning, a one way. And that in doing so, maybe the outcome's better for both groups.
Right. That's absolutely true, and it relieves the burden off of both groups. You know, it's a win in so many different ways to be a team with your patient. You know, we come to the idea of what success looks like together. You know, I don't have to be fully and solely responsible for your outcome. You know, you're responsible for your outcome. I'm responsible for helping you get to your outcome. And people are more engaged that way, and ultimately we have better outcomes.
Sure. Well, that's great. Dr.
Because that's
Sindt.
what I want. Your doctor wants you to have a great outcome. I mean, that's what everybody wants. So
That's an excellent point. I think that's what everybody on the other side, everybody wants the best outcome possible. That would be,
right.
Yeah. Well, this has been really informative. Maybe any last thoughts tonight, or really appreciate the discussion. It's very novel for this seminar series and very informative. So.
Well, I appreciate you having me. I certainly, this is a group that is near and dear to my heart. For those that know me, I have formed fruus keratoconus myself, and I have a son with keratoconus. And so knowledge does not protect you, but it does, it is helpful to understanding the outcomes. And so I want you to be able to have that same experience. It's scary. It's scary. I understand how scary it is. You know.
Yeah.
So
Thank you.
I just want it to be that thing you have, that thing you live with, and be able to move on with your life.
Yes. Get on with it, or get on. You know, be comfortable in it, and do the other things that are important to an individual.
Right.
Yeah. Well, thank you, Dr. Sindt, for your presentation this evening. It was really, really wonderful. And thank you to all the attendees who were with us this evening. Please be sure to join us for our July webinar, which will be presented by Dr. James Loden on the topic of corneal cross-linking. Until then, we hope everyone remains safe and healthy, and goodbye.
All right, thank you.